Good morning, good afternoon, good evening. Assalamu alaikum, everyone. Welcome to CView, series of webinars. Inshallah, we are starting. We took a big break due to Ramadan, so we are blessed to have Dr. Rubina Naqvi with us today. She will be discussing the ethics on transplantation. A little background of Dr. Naqvi. Rubina Naqvi is an MBBS MD nephrology, FISN PGD bioethics, professor of nephrology at the Sindh Institute of Urology and Transplantation, where she has been affiliated since 1989 and has served as a full professor since 2011. With over 3 decades of dedicated clinical, academic, and research experience, she has made significant contributions to the field of nephrology, both nationally and internationally. Dr. Naqvi has authored 121 peer-reviewed publications, including 7 book chapters, reflecting her extensive research work and academic involvement. Her special interests include acute kidney injury, AKI, particularly pregnancy-related AKI, infection-related AKI, and toxic poison-induced AKI, as well as post-transplant care, including pregnancy after transplantation and infection following transplantations, with a special focus on tuberculosis. She's also actively engaged in research on non-invasive biomarkers for renal allograft dysfunction. In addition to her clinical and research expertise, Dr. Naqvi has a strong interest in bioethics, particularly in areas related to organ transplantation, organ donation, and ethical consideration in common medical practice. Thank you, Dr. Naqvi, for joining us. The floor is yours. You can take over, and I'm going to share your screen.
Bismillahirrahmanirrahim. Qali rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatan min lisani yafqahu qawli. Thank you, Sakina, for your generous introduction, and to all the organizers of Sadiq International University for giving me this chance of talking on this forum. And I'll be talking about ethics of organ transplantation. Ethics is interconnected with the social, legal, and religious concerns, and representing how different elements blend to create a complete picture. So I cannot move the slide. I cannot move the slide. Okay, it's done.
Moving.
Over the next 45 or 50 minutes, I'll be talking about the statistics of transplantation, the main sources of organs, and the ethical challenges related to living organ donors, related donors, unrelated donors. What is transplant tourism, and the ethical challenges related to the cadaver or deceased donors, the opt-in or opt-out system, then the legal considerations, and what religion says about organ transplantation, what is the future of transplantation, the xeno and stem cells. So here is the list of organs and tissues which can be transplanted. The heart, combined heart, lung as single or double, liver, kidney, pancreas as combined transplant, pancreas, intestine, and most recently the uterus. And there is a long list of the tissues which can be transplanted. The first solid organ transplant was the kidney, which was transplanted in 1950, but the most cited one is the one which was done by Dr. Joseph Murray, which is a Nobel laureate in 1954. He did from identical twins. Then first pancreas was transplanted in 66, and liver in 67, and heart in the same year. Heart, lung combined in 1981, lung as a solitary organ in 83, intestine in 87. The first modern day attempt at a uterine transplant was occurred in 2000 in Saudi Arabia. The need for organ transplantation, it significantly outweighs the available supply, with millions of the people worldwide, they are requiring transplant annually. And this disparity is particularly more about the kidneys, and second comes the liver. While the number of transplants performed annually increases over the past few years, is still the demand, it continues to grow. Here is the number of the transplants carried out internationally in year 2023. There were approximately 172,000 solid organs were transplanted. Most common was the kidney, 111,000, followed by the liver, then heart, lung, and pancreas. This figure I have taken from the registry data system of US, because they update it is very frequently and it is easily available on websites, on their websites. So they show year-wise number of transplant done for all organs. And in 2025, as you can see here, that about 6,000 transplant from the living donors and about 35,000 from deceased donors, in a total of 41,000 transplants were done. And here, little down here is the numbers of the patient who are registered on waiting list. They are waiting for getting organ, and they are all the patients who are from one or other end organ failure. So as you can see, 120,000 are still waiting, while only 41,000 transplant were done. So only 1/4 of the patients they on waiting list, they are getting the transplant. And the main ethical dilemma, it's related to this disparity. Slides. The primary ethical dilemma, it surrounds organ the great disparity between the demand and the supply of the organs. Despite there are certain developments in field of transplant, like there are now we have improved anti-rejection treatment, and since the 1950 when transplant was started till this date, we have more potent and more targeted immunosuppressive drugs, and surgical techniques also improved. So there is a significant increase in the survival rates for solid organ transplants. And in the future, there are also possibility of xenotransplants. In fact, some xenotransplants already done. And there is possibility of their research work is going on the use of the stem cells for organ replacement. So there are certain issues and problems related with the transplantation. With the great disparity between the supply and demand, there is always a question of allocation. That with a long list, long waiting list, who will get the organ? So, and another concern is about the resource allocation of monetary resource allocation, because in some countries they have very limited budget for health. So the question arises that with the low health budget, should we focus more on simple diseases, preventable diseases which are causing mortality, like diarrhea or malaria, or young women, they are dying during childbirth. So should the money be spent on these issues, or will go to more expensive treatment like organ transplantation? Then there is a problem with understanding and attitude towards the brain death or organ donation. Not only the public, but even the professionals, they do not have clear concepts about the brain death or the organ donation. So there is a need for increased public awareness regarding this organ transplantation, and greater efforts, greater robust efforts are required to dispel the public concerns. Organ donations, in fact, they can help with the tragedy, those who are suffering with the end organ failures. And remember, the organs that are wasted are the lives which are lost. We are also lacking the hospital infrastructures. There are very limited hospitals which have proper intensive care units and who can care about the people who are on ventilators and they are labeled as brain dead, and till the time that organs are retrieved. So in many countries, we do not have enough hospital infrastructures and the trained transplant coordinator and counselors. For organ sources, there are two sources: the living and the dead. Within the living, again, there are two sources: the related donors or unrelated donors. Unrelated could be paid donors or the altruistic donors. Living-related donors, they are presumed to be the most ethical form of organ donation because the motive behind the first degree living-related renal donations are understandable, as one may assume that the living donation between relatives that it carries the same altruistic motives, that siblings donating to the siblings, or children donating to their parents, or parent donating to their children's. We assume that they have altruistic motives. In relative organ donation, the donor saves the lives and attains the well-being of its immediate relative. So they also care to care the recipients for compliance of their lifelong immunosuppressive medicines because they have donated their organs to their close family members. Altruistic organ donation considered unrelated, not they are not blood related, but they have a stable and close emotional relationship. They could be spouses, or they could be close friends. Because altruism, by definition, is the principle or practice of unselfish concern for the welfare of others. Or it is the philosophical doctrine that right action is that which produces the greatest benefit to the others. The ethical consideration for living donors, it involves balancing between the benefit to the recipient against the risk to the donor, both the physical and psychological risk. Because one who is donating is perfectly healthy person. And here the two main pillars of the ethics, the beneficence and non-maleficence, are involved because the recipient will be getting maximum benefit, and this donor should not be getting any harm. Ensuring that they are not coerced or unfairly compensated, because within the related organ donors, there could be some coercion. Like in some families, they pressurize the female siblings to donate and saving their male siblings from donating. Or sometimes within the siblings, they ask some compensation in form of either money or some land or some other relationship. So whenever there is this type of compensation involved, and then it leaves behind the pure altruism. Coming to the organ trade or commercialism in transplant, it is a very serious ethical issue because those who are getting organs by paying against the organ, they are wealthy person, and those who are donating, they are selling their organs, they are poor persons. So there is exploitation of the poor. Then it's a it's a human organ, and human body is not a thing that can be sold out. So there is a co-modification of human body, and there is also a question of the consent because one who is selling part of a body for some amount of money, there should be some coercion, and there should be a question on consent. Then it also compromises the ethical principle of bias. It also compromises the ethical principle of maleficence And there's a big question of on human dignity, because human body is not for sale for some amount of money. But there are some regional variation in its acceptance and practice. Yeah, because Iran has a model for paid organ donation. And there they slides are not moving on. Iranian, they have a government regulated system. It was established in 88, and it eliminated the kidney transplant waiting list by allowing the unrelated living donors to receive the government compensation in a fixed sum, plus some negotiated payments from recipients for their kidneys. And the Kidney Foundation of Iran, they link donor and recipient, covering the transplant cost and offering donors the medical insurance. So the donors will get some medical insurance, and their post surgery some care is taken care about in this model. But this is a very debatable model, and whenever the Iranian they present on international forums, they face criticism on this type of model. Transplant tourism, it involves traveling abroad for organ transplantation, and the major ethical concerns which I have already discussed under paid organ donation, that co-modification, coercion, human dignity, etc. In 1980s and early 90s, India was the hub for transplant tourism. But in 1994, India they have brought a legislation, and this law prohibits doing transplant on foreigners. So after this law in India in 1994, this transplant tourism diverted towards the other Asian countries like Pakistan, China, and Philippines. And in Pakistan, a number of annual organ transplant, the kidneys, it jumped after mid 90s after the ban in India. The Philippines and China from Asian region, they also have reported commercial transplant on a large scale. But after facing very severe criticism on this paid organ donation, China has also curtailed numbers after 2006 for foreigners. But Philippines, they continue to practice as in this country, the people they are who are associated with healthcare and in government, they support commercialism. They say that it brings foreign nationals and foreign currency to the country. So this is one of the Philippine magazine, the Manila Times, and the arrow shows that in one slum in Manila, the 3,000 people they admit that they have sold one of their kidney. And same was the situation in some of the small towns in province of Punjab in Pakistan. And yeah, we did at two different time points. We did the survey in these towns of Punjab, and move the slide. And when people were asked that why they sell their kidneys, the most common word they used was the word majburi. It was beyond their control. They were extremely poor. They have to pay off their debts. And there was always a middleman, the middle person who were taking them to the people who are doing the transplant surgery in main cities of, in some of the main cities of Punjab. And when they were asked that would they recommend others to sell their organs, there was a big no. In China, they have capital punishment as a legal penalty for many offenses ranging from murder to drug trafficking. And executions, they are carried out by giving lethal injections or directly shooting into the head. And mm, China actually they do not disclose all the numbers how many capital punishments they are giving by thousands annually, far more than any other nation. And in China, they were using organs of these people who were sentenced to death, and there was a regulation against it. Sorry. Thank. In China, 97% of the organ transplantation is from deceased sources, and it was mainly possible after 1984 regulation about the use of organs from condemned criminals there who were getting life sentences. This practice gives rise to a highly controversial ethical debate. Some would say that these organs can address the concern about the shortage of organs to some extent, and organs are anyway they are going to be wasted. But other would argue that under these circumstances, death sentence is seen as a means to address the organ shortage and may affect the noble cause of organ donation and the judicial system. It would hurt the primary altruistic philosophy and can place the transplant team to be seen as executioner. Also, any practice, as soon as lauded as law, it becomes coercive. Coming to the disease transplantation, again, there are two sources, either um, brain death or non-heart beating donors. Non-heart beating donors are the donors who are still on ventilator and their heart activity stops. For brain death, there is a criteria and there are list of a number of tests which are carried out by experts neurologists. Not only one time, but they repeat it after 24 or 48 hours. At least twice these tests are repeated, and when the neurologist confirm the brain death, only then the transplant retrieval, organ retrieval can be talked about with the family or the transplant surgeons. Non-heart beating, as I said, when heart activity stops, the patient is still on ventilator. Within the disease, there are two options: opt-in or opt-out system. In opt-in system is one when one has made a consent as donor. It's like someone has signed a donor card, like I did in back in June 1992. So after signing this card, we have to inform our family. So when one is faces some accident on ventilator, brain dead, then family should know. And there is a registered card which these donor registered donors they carry with them. Opt out is that someone has not clearly refused to donate, so there is a presumed consent. In opt-out policy, it requires pupils to have actively registered, as I said earlier. If the deceased person donor organ donation wishes are unknown and family is not willing, then the organs will not be removed. And people who did not get the opportunity to opt in, then their organs are not used. For opt out or presumed consent, some of the countries they have adopted this as policy, like Spain, Austria, Belgium, France, UK, Wales, and Argentina, and Chile. Uh, they say that if someone has not clearly said against donation that I would not donate my organs, then it is presumed that they have consented for organ donations. The advocate those who advocate this policy, they say that this is every person's civic duty to donate their organs once they are no longer needed to them and others require them. But the ethics would say that it is wrong to take someone's organs without their consent. And there is an argument that people sometimes people may fail to get registered even if they want to donate. They do not know the process of donating and how to get registered. They live in some remote areas, or they do not communicate it very well, so they have not registered themselves as donor. This is an argument, but counter argument is that if consent is something that must be given, then it cannot be presumed. So people who frequently choose not to donate organs for religious or cultural reasons, they might find out the most challenging to opt out for donating due to the language barriers or transportation difficulties, or for some other reasons. Then law and ethics, they go hand in hand. In every country they have their own law, state of law, but transplantation law, very little variation in the transplant law. In Pakistan, we introduced first transplant bill in the Senate in 1994, and I was part of that team who introduced this bill. We designed it according to the UN Charter and guidelines of WHO. It took a very long time to pass from both houses of legislature, the National Assembly and the Senate. In 2010, it was passed, and then there was a formation of Human Organ Transplant Authority, HOTA system, which now regulates all transplant activity in the country. After a transient drop in number of transplant done after transplant law passed in 2010, some physicians were again back in the business, and sometimes we see these in news papers that illegal transplants are going on in some of the cities in Punjab. Coming to the religions, when we talk about the religions, the most of the religions in the world, they they talk in favor of transplantation. The Buddhism, they have no rules for or against organ donation, but the center of Buddhism is a wish to relieve the suffering. Similarly, the Hinduism, there is no religious law that prohibits Hindus from donating. Although they have a concept of life after death, and they believe that they will come back, but they also believe that if they have done something good in this life, in next life, in their next life, they will get a good thing, the karma. In Judaism, in principle, they sanction and encourage the organ donation to save lives. Some of the Jews, they accept brain death criteria, while others would only agree on non-heart-beating donor. In Christianity, all mainstream Protestant denomination supports the organ donation. The Vatican strongly supports organ donation. In Islam, we have two primary sources. The first and most important fundamental source of Islamic law is the divine word, our book, the Quran, which is the absolute source. The second is the Sunnah, which is in Sunni Muslims, they define as the deeds and saying of Prophet Muhammad, while in Shia believe it's the saying and deeds of Prophet and his descendants, the 12 Imams who are chosen by God and succeed the Prophet. The secondary sources, the other juristic techniques such as Ijma, the juristic consensus, the Qiyas, the analogical reasoning, and the Aql, the human reasoning, which are considered in both school of thoughts. In Sunni Islam, they have further divisions into four major groups: the Hanafi, Shafi'i, Hanbali, and Maliki. And there is no single supreme leader for Sunni Muslims to follow. However, they have two main sources who issue the decrees. One is Al Azhar University in Cairo, and another is Islamic Council of Mecca. In addition, they have two more guidelines. One is the Organization of Islamic Medicine in Kuwait, and another in Morocco. In Shia Islam, the majority are the followers of 12 divinely chosen Imams. And according to the Shia belief that last the 12th Imam, he disappeared and will come back only the time when God knows about it. During the period of the essence of Imam, the religious leaders choose a supreme leader who has done ijtihad, the intellectual reasoning, through the use of the aql, and is reached preferably to the level of wilayat al-faqih, or at least marja taqlid. The Shia Muslims community is supposed to follow the decree from marja taqlid. In Shia Islam, ijtihad has provided a flexible situation for religious leaders to interpret the current issues related to health. In 1979, the Grand Mufti from Al-Azhar, they have allowed the decree for the living organ donations as well as cadaveric organ donations. The most detailed degree in organ transplantation was that of the Fourth International Conference, which was held in Jeddah in 1988, and it endorsed all previous decrees from 1979, and it clearly rejected on trading or trafficking of organs, and it stressed the principle of altruism. From Maraje, there are decrees from Ayatollah Ruhollah Khomeini. He has allowed both from living and as well as the cadaver donors. And Ayatollah Ali Khamenei has also allowed both from living and the dead. And he also allows that donor can ask for compensation if wishes, but he says that better give without asking for a benefit. Ayatollah Sistani has also allowed both from the living donors as well as the cadaver donors. However, he says that organs from the cadaver from Muslim body can only be transplanted to the Muslims, and sale of organ is not allowed according to him. Ayatollah Makarim Shirazi has permitted organ transplant from a brain dead patient, and he says that if it is completely and definitely diagnosed and when it is declared as irreversible by the treating physicians. Coming to the xenotransplantation, it started back in 1963 and 64 when a series of 6 chimpanzees kidneys were transplanted. They were not very successful. The recipients, they died within weeks or a few months, but it was done there. In 84, the baboon's heart was transplanted, then baboon's liver in 1992. In 2005, the porcine islet were transplanted in diabetes type 1 patients, porcine skin for burn patients, and pig neuronal cells for Parkinsonism and Huntington's disease were also transplanted. All references are given there in the slide there. A genetically engineered pig cardiac transplant was carried out in 2022 at the University of Maryland. The ethical issues with xenotransplantations were that should human be exposed to a trial of xenotransplantation, because in the field of medicine, any medicine or any surgical technique which is used on human being is get a preclinical trial. So this xenotransplantation has not given a preclinical trial. So is it ethical to do this type of transplant? This is an argument. This is an argument. The other ethical issues included the use of animals. The genetic alterations are there, and there are complexities of informed consent for research subjects, justice of including or excluding the respective group of human subjects in clinical trials. And by doing the transgenic implants, are we using animals as a mean to an end? And this is also an ethical issue because animals here are used as mean to an end. This was a survey carried out in United States to see the attitude towards the xenotransplantation, and it was done in 2023, and 5,238 individuals were elected to initiate the survey. The two largest groups of respondents by religious tradition, they were Christians. 40% were Protestants, and 16 were Catholic. 16% were Catholic. Smaller proportions of persons identifying as Muslims, 2.5%, Jews, 2.3%, more Mormons, 1%, Buddhist, Hindu, and Orthodox were also responded in a small number. Muslims and Catholics respondents reported higher rates of familiarity with xenotransplantation and lower level of discomfort with xenotransplantation, including their own self or for a loved one. This is very busy slide, and I'm not going to read all the details, but it shows the behavior of different faith groups towards, from religious point of view, towards the xenotransplantation. And both the Shia and Sunni Muslims, they say that when it comes to save life of a human being, then it can be acceptable. Coming to the stem, the types of stem cells are, they could be embryonic stem cells or somatic stem cells from adults, or the perinatal taken from the umbilical cord or placenta at the time of childbirth, or they could be induced, which can be prepared as pluripotent cells in laboratory. So somatic stem cells, hematopoietic stem cells, as a bone marrow transplant, are already in practice for a long time and is used in blood cancers like leukemia, lymphoma, other disorders like aplastic anemia or other immune diseases. The stem cell transplantation for organ replacement is an advanced regenerative medicine technique, and it is aimed as repairing or replacing the damaged tissues using stem cells and offering a future alternative to traditional organ transplantation. Researchers, they are developing methods to grow, specialize, and transplant stem cells, or even engineer the whole organs in lab to treat the conditions like Parkinson's disease, heart diseases, or end organ failures. While hematopoietic transplants are common, using stem cells to engineer entire complex solid organs is still largely in research stages, with challenges in scalability and also a cost is involved in this. Ethical consideration, the core of the controversy is whether if we are using the embryonic stem cells, which is the 3 to 5 days old embryo, the blastocyst stage. The concern is that if at this stage embryo will be called as person or granted as personhood, or embryo at this stage has legal rights as other human beings have. Then in vitro fertilization, which is in itself a very lengthy topic. In vitro fertilization, what happens that they prepare multiple embryos because the failure rate is very high in IVF. So if pregnancy is good, successful, then the other embryos, they are destroyed, or they can be used for other purposes. So the ethical issues arises there, that these leftover IVF embryos, they should be used for stem cell research work or later on in transplantation. So, who will give the consent, and where who will where it will go from here, from a petri dish to the laboratory. So, all this involves very serious ethical issues. Research specific embryos, creating embryos only for the purpose of research is also a controversial issue. And it is again seen by some as co-modification of human life. Then therapeutic cloning, creating a cloned embryo to harvest the patient matched cells, raises a fear of a slippery slope, because when we are cloning a desired cells, like an organ like a kidney, we are creating embryo for making kidneys. So one can, when one get expert, can create very intelligent with very high Q, blue eyes, or uh, white skin or colored hairs, etc. So it's a slippery slope, and we cannot stop it once the technology is established. Religious perspective regarding the stem cell is that it's about when a person is called a being. In Catholics and conservative Protestants, they generally they do believe that life starts at the moment the conception occurs. So the embryo at the stage of 3 or 5 days is also a being. Whereas in Judaism and Islam, they support the research on early stages of the embryo, because in their tradition, the embryo is generally not considered as a full person, because they have the concept of soul. So it could be 40 days in as in Jews, and or in 120 days as in Muslims. Uh, Within Buddhism and Hinduism, they have the mixed views, but they often lean towards supporting the research if it is motivated by compassion and the goal is to end the suffering. The modern alternative, the discovery of induced pluripotent stem cells, the adult cells, they reprogrammed to, and the adult cells are taken and they are reprogrammed to an embryonic like state. So they have bypassed the many of those ethical hurdles that when life starts and when should be taken, and the destruction of an embryo is like killing a person. These all are addressed when this is done in laboratory from stems. Adult cells, they are programmed to an embryonic like state. Declaration of Istanbul, it was a document which was created in Istanbul summit in 2008. It was held in Istanbul, Turkey, and it condemns the organ trafficking, transplant tourism, and commercialism. It aims to ensure the equitable access to transplant without exploiting the poor or vulnerable by treating organs as gift, not commodities. It defines organ trafficking and transplant commercialism as unethical, calling for global bans and penalties for this practice. This declaration promotes donation as altruistic and provides ethical guidelines for professionals, policymakers, and governments to fight exploitation and promote the fair practices. So, to conclude all this, the treating team, who are doing the transplant, they must respect the cultural and religious beliefs of the family who are involved in donating and those who are receiving the organs. Because religious and cultural beliefs, they do carry a weight in their self. Transplant from brain dead donors, they provide beneficence to end organ failure patients. Justice can be done by offering organs to the most suitable recipients, and allocation of the organ should be justified. The waiting list has a waiting list prioritizing patients based on morally relevant considerations, because those who are involved in selecting the patients, they know that who is the one most appropriate person to receive limited organs. There is also utilitarian concept which can be seen by brain dead organ donors. As you can recall from my first slide, I have shown the long list of solid organs and the tissues. So one single dying person can donate to so many suffering people who are suffering from organ failures or require or in need of other tissues. So this is a utilitarian approach. One person can give benefit to so many people. So by this, I would like to thank all of you for listening, and I'm ready to take the questions.
Thank you, Dr. Rubina Naqvi. This was a very good and very detailed presentation. I really enjoyed it. Anybody have any questions?
There is no question in the chat box, but if anybody asks the question directly, raise the hand.
Not too long ago, I was helping a friend's brother-in-law to get a kidney transplant. He had in India, he had one of the relatives who were ready to give kidney, but he had to go through a lot of political hoops to get permission. And I'm sure some of the Indian professors who have joined, they will have more details. I, living in US, was only monitoring and maybe connecting them to people I had known. So to get the permissions, but it took them months to get the permission. And in the meantime, we were worried that his health was going down every day that he was waiting for the permission. Anybody from India has any input on that? How do you guys handle?
Sakina,
Yes.
Sakina,
Yes.
can you ask Dr. Naqvi, has there been any recent fatwas about giving your organ to non-Muslims? We can accept, but I do not know. Any Maharaja has thought about it?
Yes, yes, Dr. Said, I am Professor Bukhari. We have
Hi,
a fatwa
Assalamu
from,
alaikum, Mulazim bhai. Because
we have
I
the
know,
fatwa, yes, we have the fatwa from Shistani, yet to save the life of the human beings, it does not matter that if you are donating your organ to non-Muslim, or if you are getting the organ from the non-Muslim to the Muslims.
Alhamdulillah, I would just narrate an incident in 2000. We were having the IMI annual meet in Delhi, and I was against everybody, and only Kalwa Sajid Sahab Marhum said what SN is saying right. I said this is absolutely not true. Once you can have it, and your motto of the IMI is to save the life of every human. If you take a life of one, it's equivalent to taking the life of the whole humanity. I'm glad the fatwa has come. Thank you for increasing my knowledge. Thanks a lot.
All of the Maharaja, they support organ transplantation in favor of saving the human life.
Yeah, I'm
from
thank
any
you,
source.
Dr. Yeah, I know it was only Kalpasad was on my side. There was a lot of big discussion, but they said no, it is. I mean, if you have to save the life, you have to save it. It doesn't matter.
So,
You know, he's
Rubina,
a Muslim. I'm a Muslim because I was born in a Muslim house. He's a
sir, somebody India from Yagesh.
Thank you very much.
Professor Shabi,
Dr.
somebody
Naqvi,
has.
it was an excellent overview of all you have discussed. Thank you.
So I was going to say, Rubina, that you mentioned about Daniel Hurst's report. Now, Daniel Hurst invited me to represent Islam, and I think I've got is my echoing. Can you hear me at all?
Yes,
Yeah, I can.
you
Sir,
have
we are hearing, but somebody has opened two devices at
Yes,
one time.
that's mine because I'm trying to do it on the phone, and my iPad is dying shortly. So I'm trying to switch off to my phone.
Sir, you switch on, ji, sir.
So what I was saying was, Rubina,
That's okay.
Daniel Hurst report that you mentioned, I was a part of that activity. He invited several people from all faiths, like you mentioned, Christianity, Muslim, Sikh, Hindu, non-believers, etc. So I consulted Ayatollah Sistani's office in that respect because that was a question of zero transplantation using porcine tissue. Remember the famous Maryland thing that you mentioned? And the answer that came was very simple. Like Dr. Essence just said, that if you save one life, as if you've saved the entire humanity. So it was approved, and that is exactly the point. I've got a couple of more points that I've noted down. You mentioned about utilitarianism and deontology. Utilitarianism, in my view, is a much better ethics because, like you mentioned, from one dead body, you can take different organs. The question that arises, for example, if you have already transplanted a heart in a patient or a kidney, and that patient comes back after 5-10 years with a rejection, would you repeat the transplant on the same person or distribute the body to others? Get my point?
Yeah. Because there is always a long waiting list. So sometimes this question is debated, that the one who has already once received organ and now it's failed, so should he receive the second transplant, or the other one who has not gotten one single chance, he should receive the organ. So it depends upon the situation, and the on waiting list there are other parameters also which they take, like general medical condition and living areas from communities and where they are coming. So
Yeah.
they have points which they level, and according to them they decide to get the.
So my point of contention is this, that is it not better to give a quality of life to the one who had already received, give him the organ again and improve his quality of life as compared to multiple people living with poor quality of life?
Well, how
They
could
should
you decide?
they should also
Yeah.
get a chance.
Huh?
They should also get a chance.
Yeah. And how would you decide who gets to live and who gets?
Yes, that's
So
right.
that's the scary part.
There is no simple answer to this query actually.
These slippery slopes. Now, in the
Yeah.
UK, Abbas Ghazanfar gave a talk last year and said that we have a national waiting list. So if somebody has a problem like in Scotland, the organ can be shifted from UK, etc. Does that exist in Pakistan, also in India? Is it a national waiting
Yeah.
list, maybe?
By law in Pakistan, the foreigners, they cannot get organs from if someone deceased person is donating organs. So foreigners should not get. Only the Pakistanis can get this organs
But is there a
by law.
national
Also
waiting
in
list?
India,
Like,
there is every center they have their own list, but not a centrally registered list. It's lacking there, and even on transplant, the dialysis patients or transplant waiting list, they are not centrally monitored actually in Pakistan.
right.
But every
Now,
center they have their own. It's like
Yes, this is what Shahzad said last time. He is the chairman of the transplant program in Punjab. Now, the question of opting out is becoming a major debate in the UK. In England and Wales, they passed a rule that you have to opt out. Otherwise, it will presume consent. What is the situation in Pakistan and India?
In Pakistan, actually, very few people they give consent for organ donation, and even those who gave their consent for donation, sometimes their families come when, because the person who has given the consent, he is already brain dead and he cannot decide at that moment. Then the family comes forward, and some of the family members they do not allow. That's why it's not taking off from for deceased organ transplant in Pakistan, because large family system, joint family system, and one members come from far relations, and they say no, we will not.
Let me just give you an example of cross-border altruism. There was a gentleman called Professor Hiranandani, very famous head and neck surgeon. I invited him to Pakistan many years ago, and when he went back, he wrote a will and he donated his organs to different countries. He gave eyes to me, his heart to his son, his kidneys to somebody in England, in his will. I still have a copy of that. And that's an amazing example of altruism. Do we have such examples in Pakistan? Doubt it.
I don't think they understand that is also possible.
Myself, I can show you that I signed this donor card, and it says that my kidney, cornea, heart, lung, liver, pancreas can be used for transplantation or any part of my body. And I signed it in back in June 1992, and my family knows very well about it. So some people they do register as donor properly, and we have their list.
Yeah, but Sakina, in the US, it's a different thing. When you take an oath that you're a US citizen, you have to sign a donor card. Isn't that right?
Yeah, not just a citizen. When you go to get your driver license in places like that, they will ask you if you want to. They won't push you. It's all up to you if you want to do it or not. I have not done. I would love to do it, but the time when I was offered, we didn't have the fatwa that you are able to do it. But now hearing all of this, inshallah, I will. My daughter is very keen on that. She always argues. When she was in high school, she was working with an Indian doctor in Houston, doing research on transplants, pig lung transplant. So she was very excited about that, and she used to argue with me why I didn't sign the consent for organ donation. So I will let her know that we can do it now.
Yeah.
So that's good to know. Yes. Dr. Yogesh, do you want to share what the Indian government has? You shared a list of the process.
Good evening.
Good evening.
Yeah, in India after 1994 we came up with the Law Organ Donation Act, which has been improving day by day. And what I understand, there is a national registry which is maintained by NOTU. Then there is a regional organization. Then there is a state organization. So all are in a hierarchy order. And if there is a requirement of organ, like the things are in process, like you have to request. If someone dies, it has to be put into the registry or their portal, and they try to see who is the donor who will be getting benefited. And then depending on the requirement, like if someone dies in Mumbai and the requirement is in Delhi, then there is a green highway created so that the organ after retrieval is taken to Delhi without any loss of time. So things are in good. Only thing, it is the post death. So convincing the relatives of the people, the one who has lost, is the difficult part. But once they agree, then the full system comes into place. All the police, what is that called? The airport, all the authorities are in sync. Once the organ donation is planned, then everything is streamlined. So that is how it is working in India. And about the what Sakina said about that difficulty part, I am surprised to hear about it, because the thing is, the politicians have no role in this. But as in India, there will be something. But once the relative, like relative, again, it has to fall in the rules. Who
Yeah.
is allowed to rule? So there might be some issue with that technicalities. Otherwise, if it is like a family donation, there should not be any problem, because what Indian government is trying to do is that the donation should not be sold. That is the whole
Right.
motive of the government. In some places, it might still happen, but it is tracked down. It is like, it's not a organ donation is not a small thing. So you need a full-fledged hospital. So a full-fledged hospital cannot get into all these wrong things. So things are very streamlined in India as of now, what I understand.
I think the issue was he was a resident of Bangalore, but his in-laws were in Hyderabad and he was getting treated in Hyderabad and he wanted to do the transplant in Hyderabad. So that was because there were two different states involved. There was a big issue. I think the Bangalore had given him okay, but the Andhra wasn't giving him an okay. So that was where I had to come in. They called me, and I had a friend who, the person who was the final approver was a friend or a classmate of one of the other friends I have. He's a cardiologist here. So he reached out to his friend and asked for a favor. And that's how the transplant was able
As
to
far as I
happen.
understand, if you can prove that it is a allowed donation within the family and there is no money transaction, no one will stop it.
Yeah, I hope.
As
Yeah,
simple as that.
I'm sure there was something that was
And
lacking.
definitely.
Yeah. But another question I have, say, for example, I am close to dying, or I know I'm going to die very soon. Can I say, okay, give my heart to this person and give my eyes to that person? Can I pick and choose?
No, no, it is not allowed. You have
No,
to
no.
accept for donation. You
Mhm.
have to give permission for donation, and the registry will decide who is a suitable acceptor. That is
Okay.
what is followed.
Is that how it
Unless
is?
it
No,
is
no.
your,
In your life, you cannot. As
Okay.
such, you cannot. You see death is near, you cannot donate unless you are certified as brain dead.
No, I mean, say I'm dying and I say, okay, I'm going to die very soon. I have 2 weeks to live, but I want to donate my organs, but I have family members or I have friends who really need it. Can I say, okay, give my heart to this person, give my eyes to this person?
Yeah, that you can do.
Oh,
Like
okay.
you can say that after my death, my
Mhm.
heart should go to that particular person. That you can do.
Okay.
You can wish.
Okay. So in Pakistan, you can do it, but not in India. That's what I'm hearing. But it's very interesting. There is so much involved in saving lives. And sometimes I'm happy that I'm not a doctor to make all these decisions. So great. Thank you so much. I really appreciate. Anybody else have any questions?
Thank you.
Perfect. Active my intention to become an. So I have a note from Mr. Ibrahim. He says, "Dear Ms. Naqvi, thank you for conducting such an informative session. I would like to express my intention to become an organ donor to help those in need. I am currently residing in Sargodha, Punjab, Pakistan, and would appreciate your guidance on the appropriate institution and the process through which I can officially register for organ donation. Kindly advise regarding the required steps, documentation, and any legal or medical considerations involved. Thank you for your support."
You can simply register by going on the SIUT website, www.siut.org, and they have a page for organ donor registration. And once he get registered there, they will mail his donor card to him on his address.
Okay.
And
Can you
he will be on this.
Can you share that link with me, and I will post it on our website, on our WhatsApp group, so more people
How
can. You can
how
share
can
it on WhatsApp later, not right now.
Okay.
Okay. And you, Dr. Yogesh, do you have how Indians can register for organ donation? Maybe we can share that information too.
I think the website has the link for donation. You can register for it. I will
Can
just
you share
try
that
to
website?
put the link. Yeah, I will try
Perfect.
to locate,
Okay, thank you
or
so
I
much.
will put
Appreciate
it
it.
in the your Sivu WhatsApp group
Okay.
if I.
Perfect. Perfect. Thank you so much. Appreciate it.
Hold on.
Anybody else have
One
any
minute.
questions?